Hi there, everyone. It's Angela Gill with the MHP Foundation. I'm here today with someone special, but before I get into that very much, I want to let you know what's going on with this video. If you've been watching and listening, you know that we kicked off our year-end fundraising campaign at the foundation on December 1st, which is Giving Tuesday. And what we're doing this year, we invited our staff to submit applications for projects that they have come up with to help them do a better job serving our community. And one of those projects came from the MHP Plastic and Cosmetic Surgery Office, and they would like to increase their education efforts with patients who either have skin cancer or who are at risk for skin cancer by giving them a sample of a sunscreen or an SPF. And I'm here today with Kylie DeBon. Believe it or not, Kylie has been a patient at MHP Plastic and Cosmetic Surgery because she had a little scare with skin cancer. And she is here to tell us her story. And one thing that I really kind of like about this is Kylie is also a staff member at MHP working at the Sleep Center. So she knows both sides of the coin on this, what it's like to be a patient, and she understands the standards that we hold our staff to, and we did that with her, and she was happy with her experience. So anyway, let's back up a little bit, and Kylie, why don't you tell us your story?
Thank you, Angela. My story basically starts with I had a spot. It was on my hip on my right side. And I had the spot for several years. I had been in college and I had been in a health class, and I remember them talking about skin cancer and knowing your skin and watching spots. And so fast forward a few years, I had this spot that started itching. Not all the time, it was just random. But after a while, I kind of thought, I remember them talking about that in that health class. So I made an appointment with Dr. Christea at the plastics office and went in. He took a look at it. He removed the spot. No big deal. He didn't seem to think of, it was at risk for anything. And so I came back a couple weeks later and I was diagnosed with stage 1A malignant melanoma. That was pretty shocking. I knew I was at risk because I had tanned a lot when I was younger, and I would wear sunscreen in my younger years sometimes, not all the time. And so he and the staff were great. Tammy, I remember, was the medical assistant in there with me that day. They were very thorough, explained everything, explained what would happen next. They scheduled me for surgery to remove the melanoma. And so I had that done in June of last year is when I had it removed. And so since then, and I know Dr. Christea said this first thing, I would be a patient for life with them or, a dermatologist, but they would keep track of me from that point on. And so since then, I have been seeing them for the first year every 3 months, and now it's every 6 months, thankfully. But that's a little bit about my story.
Yeah, I didn't know that had happened to you. I had no idea. Yeah, so you and you're a young person.
Yeah.
It's surprising, but just partly because of that, and you just don't think about those kinds of things.
Yeah.
So, if you had to give some advice to people who want to be sure they avoid having a similar experience, or what would your advice to them be?
Well, definitely know your skin and pay attention to it. But more importantly, wear sunscreen to prevent skin cancer. I wish when I was younger I had done a better job of that. But yes, wear sunscreen most definitely.
Okay, that's great. I'm glad you're healthy.
Thank you. Me too.
Kylie, thank you very much.